it. I see a few more people joining in, so we're going to give them 30 seconds of pure grace at 7:30 this morning, so they can get in to the session. Let me reshare my screen. All right. So we're going to go ahead and get started. Let me check and see if all of our speakers are here. Let me see. Do I see Miriam? I think I saw Miriam. Yep, I saw Miriam. And Katie. Do I see Katie? Yep, I see Katie. All right. So we're ready to roll. So good morning. Thank you all so much for being here today. I know it is bright and early, but we're excited to have you here. We are in the middle of something that is exciting. At the same time, it could be a little anxious building, right? And so today we're here with our providers and our Medicaid advocates to talk about our federal Medicaid continuous coverage and what that means for so many of you in this field, so many of you that are serving our Medicaid recipients. We are so excited to have you here to have this discussion, to share where we are in our plans, and to give you any advice or guidance or answer any questions that we can hear or through a follow-up document in order to make sure you feel reassured and self-assured in the process you're about to embark on. And so I am going to turn this over to, before I get started, some logistical things. If you have a question, you are more than encouraged to drop them in the Q&A. We're going to be gathering those throughout. I know some of you submitted questions ahead of time. We want to make sure that we're pulling as many of those as possible and making sure we're addressing those and providing as much clarity as we can. Also, if you want to provide any additional information, we ask that you limit what's going on in the chat so that we can make sure we focus on answering those questions. The chat, you will be able to have a conversation with the host, myself, or any of the presenters. So we ask that you use the Q&A primarily in order to submit your questions. All right, so we'll go ahead and get started. So we will start this morning. Well, each of us will do an introduction first, and then we'll hand it over to Miriam. My name is Natalie Pennywell. I'm the Outreach and Member Engagement Manager here at DMAS. Excited to join you. I'm going to ask Miriam to pop on, and then Catherine pop on to introduce themselves, and then we'll go ahead and get started.
Awesome. Good morning, everybody. My name is Miriam Siddiqui. I'm a senior advisor in the director's office at DMAS. Catherine?
Good morning, everybody. I am Catherine O'Connell Raymond. I'm a Medicaid program consultant with the Virginia Department of Social Services at home office. Thank you.
Okay. Good morning, everybody. Thank you so much for joining again. It's super, super early, but we wanted to make sure this time works for you all. We are very excited that you can join our first town hall on unwinding, as I like to call it. Unwinding is a household term in my house now. My kids know it, but I do want to do a quick level setting. What does that mean for us? And you can go to next slide. Natalie, thank you. Unwinding process basically means involves restarting our renewal process for Medicaid members. In the response for COVID-19 pandemic, federal government provided additional FMAP or additional funding for Medicaid agencies to ensure that we can allow members to stay on Medicaid during the pandemic. Starting March of 2023, basically next month, we are beginning our 12-month renewal process. Basically, this is when we will restart renewing our members for the next 12 months. What we really need to, why are we really here? We want to make sure that we share the information about the upcoming renewal process and how you can support us. Next slide, please. So this process is not just a DMAS Medicaid process. It's a combined effort between DMAS and DSS because the renewals are really done at the local Department of Social Services where BDSS has oversight. So all of these unwinding efforts are really a combined effort between DMAS, Medicaid agency, as well as Department of Social Services. For the last 2 years, we've been really, we knew this was going to come. We were anticipating renewals to restart at some point. And so in that effort, we've been preparing our systems and our collaborations to really make a big impact and make it easier for us whenever the renewals will begin. So a couple of things I want to highlight here. We've made many system updates, additional automation, and make the process more efficient for the local Department of Social Services standpoint. So that way there's less manual work to be done and more of the renewals can be done automatically. The other one I want to highlight is collaborating with our MCOs, our health plans. They have been a great partner with us and sharing the information and educating our members on what it would look like for them once the renewal begins. In addition, they've been really supporting our efforts in getting the up-to-date contact information for our members. Obviously, we haven't reached out to them in a couple years, so we want to make sure that we have the best contact information to reach them. Next slide, please. Go. I just want to kind of talk through, I want to talk through a couple of just understanding what our process will look like. So CMS, HHS has been providing lots of guidance to us, in terms of what the unwinding or renewals will look like when this begins. I see I'm sorry, Natalie, I see some chats about there's some noise. And it's hard to hear. Can everybody hear me? Okay, I see
Yes.
Catherine. Okay.
Yes, no problem.
Okay, so maybe some of the folks are having some problems. Okay, thank you guys. You know, I'm not a technical person. My best solution is maybe relog back in, log off and come back. Maybe that would be helpful. Okay, thanks everybody. So I just want to highlight just a quick process in terms of what it would look like. What do we have to do when we start this renewal process in March? The states must first try to do redetermination or renewals automatically, meaning going through the system. If we have all the information for someone who's going through a renewal process, we don't need any additional information. They will just get renewed automatically for another year, and they'll get a notice of action in the mail that they have been renewed for another 12 months. If we do need additional information from the member to verify their eligibility, state will send a pre-populated renewal form, and this is about 10 pages or so of renew. It's a pre-populated, but it's a 10-page document that will go to the member's house, whatever the address they have on our file. That will give the member 30 days to respond to that renewal packet. Once we receive the renewal packet, the eligibility worker will review the documentation and do the eligibility determination. States must send out an adverse notice action prior to termination. This is the notice of action that members will receive if they're no longer eligible for Medicaid. Just want to again highlight this is a 12-month batch process. Every month, a certain number of groups, a certain number of members will go through the renewal process, and then if they get paper packet, they'll have 30 days to respond. So this will go on for next 12 months starting in March. Next slide, please. Perfect. I'm trying to make that the whole 12-month point come across, but because I feel like it can be a little confusing. Just what I mentioned, and starting in March, we'll begin the full renewal process. We'll give folks 30 days to respond. If they get a paper packet, and the first closures will not occur until April 30th. This will go on all the way towards for the full year, and then at the end we will do some cleanup, make sure everything is good, and basically normal things will go back to normal starting May 2024. It won't be part of the unwinding renewals. It'll just be part of the regular Medicaid business. Next slide, please. I'm not going to go into all the details here, but this is a really nice visual to just understand all the things that Medicaid and DSS have been working in the last 2 years in preparation for unwinding or resuming normal business. We have done lots of system changes, stakeholder engagement. We have sent letters to our members to make sure we have their up-to-date addresses. Done social media campaigns and radio campaigns. Just a nice reminder that all the things we have done to make this process as successful as possible. Okay, at this point, I'll punt it to Katie.
All right, good morning again, and I'm going to go over some of the steps we at Virginia Department of Social Services have been taking to prepare for this immense task. As Miriam had said, that we are doing things in conjunction with the Department of Medical Assistance Services and stakeholders by having definite messaging that's going out and going out to the local agencies that gives them information about how this unwinding, quote unquote, is going to affect all of the programs, not just medical assistance. It's going to have an impact on other benefit programs such as SNAP and TANF. But we are having on our part joint monthly unwinding meetings, of course virtual. VDSS and DMS are jointly participating in monthly calls to communicate things that are occurring for the local agencies and their other state partners. And, just to reiterate that we're making resources available to local staff, whether they're FAQs, scripts that they can take advantage of at the local level when customers have an interruption in their benefits and they call the local agency, what they can anticipate those calls to be, how to handle them, how to handle any subsequent appeals. And we're giving out different advice and guidance to them on how to prepare for this. As Miriam mentioned, it's going to be a 12-month process to try to take into account all the overdue reviews and trying not to overwhelm the local agencies with this massive amount of work that's coming their way. And there is an unwinding portal that's a one-stop shop that's on our internal system, our intranet that we call Fusion. And on that intranet, there's important information and guidance, different decks, presentations, and recordings from all the different things that we're trying to put out there to help prepare everyone for what's getting ready to occur. Next slide, please. For you all, and on the public-facing side, and a lot of this is just reiterating what's already been gone over before, but we're working on having social media messaging. I've actually seen it out there, and it's pretty handy. And so they're putting messages out on social platforms that our customers might be involved on, such as Facebook and Twitter. And those have been posted consistently since November of this past year, letting them know about Virginia's plan for returning to normal operations. We have a site where individuals can apply for all benefit programs, pretty much, called Common Help. And there's a public-facing message on that site that has messaging about the public health emergency and the unwinding information. And that has been posted since November 22 as well. And that gives you the link to that website, which is pretty helpful for people to go into. And just, just a short message about Common Help. It is an online portal where people can apply, but they also can go on and check the status of an application. They can check the status of a renewal. They can report changes, submit renewals by linking their account. It's very handy, I think, in today's world. The majority of people like to do things online. And so that's a helpful tool for the customers to actively get in touch with their local agencies. VDSS has also been doing some public site messaging, and that is on the external page at the dss.virginia.gov website. And so there's messaging there that will address this unwinding information and the resources that are available. And we're working on deploying some radio public service announcements. And so those are going to go out regionally and are currently in development and are going to go out, and people will start hearing those soon. I think I saw a schedule for something recently. And there's been a joint press release between DMAS and VDSS that's in development, and it's going to be ready fairly soon for public viewing after DMAS's review, input, and approval. Next slide, please. This, and it's a little bit hard for everybody to see, but is what we've put together is a one-pager that will be deployed, and it addresses to people all of the benefit programs that are impacted by what we're calling the unwinding. It's not just Medicaid, it's other programs as well that are being impacted and that your customers might remark to you that have had some impact on their lives. Of course, to me and to probably everybody here, medical assistance is the most important, but SNAP has had a lot of changes as well that are a big impactor to the community, and so they're trying to handle those as well. And so this is going to be available. They're waiting on getting it translated, and so that will be disseminated after that. But that's a fairly handy tool that is going to be available. Next slide, please. And just some general guidance that we have out there. We're really trying on our end at the state, between us and DMAS, to get staff ready for this unwinding after 3 years. We are making different trainings available to everyone. We've started with refreshers on how to do renewals and what to expect when they're going into the system. And, just like everyone else, we've been having lots of meetings and roundtables to address with local staff best practices, what to address, how to get ready for this change so we can make sure that people have the coverage that they need. We're also using to disseminate information, something called a listserv and a broadcast, which is a statewide memo that goes out on our intranet, and just putting out there to everyone, what can they do? How can we prepare? And so we've done different things internally that are available to staff, different guidance and procedures, and we're having subject matter panel experts. I have one later today where staff can ask, what can they do to prepare, what to expect, special scenarios, and just for trying to get the guidance out there so people are feeling ready for this. As I mentioned before, the different e-learnings that are led, and just making sure that everybody is prepared. I think that's the big thing. I was a Girl Scout leader. Let's be prepared. We know this is going to be a massive undertaking, and it's going to have an impact on the provider side, which I was thinking of yesterday. What can you do if someone shows up and you discover their Medicaid has been canceled, or you go to bill and their Medicaid has been canceled? They're going to have to reach out to their local agency and try to resolve that. There is, if someone gets closed for not returning their renewal, a 90-day grace period. They're still closed, but they have a 90-day period to turn information in for their renewal, whether it's verifications that are required or it's the actual redetermination. And they have that opportunity there. The state is also trying to prepare them to do as many renewals. I think Miriam had mentioned earlier, touchless, where it goes ex parte through the system, but only certain covered groups for Medicaid meet that criteria. Unfortunately, the age, blind, disabled population do not meet that criteria and do require a renewal that we have sent to them completed with all the information returned. But we're trying to get everyone ready and all have a joint issue. I saw a question there. It said, when does the 90-day grace period start? The 90-day grace period starts after an individual's coverage has been closed. So if they were closed effective May 31st, that grace period starts on June 1st through the next 90 days. And upon that grace period, if someone returns that verification or renewal, they have 30 days from the time that's returned to the local agency for it to be processed. And so that's just something, you know, to keep under your hat, that if someone is closed, they still have an opportunity to complete their renewal within a certain time frame. I believe that's all for now, and so I'm going to hand that back over. Thank you.
Thank you so much, Katie. So we have, as I like to think of it oftentimes when we think of baking a cake, right? When we're thinking of preparing, we're doing all the prep work. We've been doing prep work for a long time. And so now I'm thinking through, Katie gave you some of the things BDS is doing, and we're doing some things in conjunction regarding what does outreach engagement communications look like, not only to you as stakeholders, but to our members? What do they have access to? What are we sharing with our stakeholders in order for them to make sure they're navigating this process while, taking in all of these shifts and changes that are taking place. So our outreach engagement communications planning is a three-pronged process. It's updating contact information, completing the actual renewal process, and then if someone has lost the coverage, what is the next step? How can we make sure they're being reconsidered or they're being redirected where they need to in order to maintain health coverage? Those three particular phases, we've been in phase one for a while now. We've been in phase one as of tomorrow. It will be a full year of making sure people, and we're encouraging our members to stay to keep their information updated. We can't contact them if we don't know how to, if we can't reach them. That is the linchpin, right? That is foundational to all the work that you see being done. BDSS and DMAS, as well as our other partners, which includes our MCO stakeholders like yourself, we all want to make sure our members maintain their coverage of some kind. It's important that they have health coverage, and whether it's with us or someone else, it's important that we're able to reach them. And so that we could do that, we need to make sure that they update their contact information. So in this first phase of information, which will continue through, because if we don't have an updated contact information, we can't do phase two nor phase three. So we want to make sure that that stays a pervasive message. We encourage our members to update their contact information. Phase two started this month, right? We'll encourage our members to complete their paperwork. Once they start to receive it, once the process actually begins, we've turned up that lever, and now they're starting to receive communications from Virginia Medicaid. We want to make sure they actually complete that. We have messaging that goes along with that, right? Review, respond, renew. We want to make sure they understand that it's really important that they maintain their coverage, but in order to do so, we need them to actually fill out and complete the paperwork that comes their way. And maybe they'll be lucky, they'll go through ex parte, they won't have so many things to do, they'll get a wonderful notice, but that's not going to be the vast majority, right? That's not going to be everybody. And if that's not everybody, we want to make sure that you have what you need. In phase three, the main purpose is to make sure if members who've lost coverage due to administrative reasons need to complete paperwork for whatever reason, we want to make sure that they actually do that they, if they're in that grace period that Katie just talked about, that they return what they need still, or if they need to be redirected to another resource within the Commonwealth in order to maintain coverage, we wanted to make sure that they do that. So that's the third phase. So we have these three phases. We're in them. We're making sure we provide different resources and tools in order to do that. So when we talk about what that communications plan has looked like thus far, what have we been able to accomplish? We've had a digital ad campaign, and our strategic communications team, as well as the team over at BDSS, have been working through different ways in which to coordinate and respond and share the information that's going on. Social media campaign, we've had our Cover Virginia website has had some updates, and we've had different websites to include VDSS and our main website that redirects to some of the information that's taken place or is held on our Cover Virginia website. Toolkits have been developed. They're already on our website, and I'll show you like a preview of what those look like next. We've mailed member flyers and posters and information to our local Department of Social Services and our Community Services Board. For phase one, we'll do it again in phase two as those materials become available in order to just give them a jump start on sharing that information where necessary. We've also had translated documents into 7 different languages to include English and Spanish and a couple of other ones. And those are to make sure that, people receive information in different kind of ways. And for us, it's really important that when they're trying to receive that information, that I'm sorry, when they're trying to receive that information, that they do so in a way that is easy for them to understand, so they can best communicate with any stakeholder or partner that they need to about their process or what they need to do in order to move forward in the process. For you, we've provided memos, informed our health plans. Our MCOs have been really great partners. We've held virtual meetings with you individually, with organizations, in order to best make sure that you're navigating this process with the resources and tools that you need to be successful again. We have toolkits that we've mentioned before, and we've started these town halls, these listening sessions, in order for us to share more information with you and gather as many questions as we can about the process so you feel confident about what's going on. So our toolkits look like this. They're phase 1, 2, and 3 are together. They're on our Cover Virginia website under the Return to Normal tab at the top right corner. And then if you click on that, you'll see 4 bars at the top, and it's the toolkits and materials. Our website is going to do a little bit of shifting in the next couple of weeks. And with that, you'll see the same kind of prompts, and you can follow the same kind of pathway. And then you'll be able to see a lot of different components. If you're interested in what this looks like or interested in what this information is, don't hesitate to reach out. Be more than happy to share more of those things. And is this me? Or okay, I'll cover it, and then I think Miriam comes up again next. So what is the main takeaways from all of these different components? Is making sure that renewals begin in March. Some members will get paper renewal packets in the mail, some won't, but it's making sure that they have all the resources and information that they need in order to successfully complete whatever comes their way. This is a 12-month process. This is not going to happen all at once. Our members we want to make sure they understand that when that comes, when they actually hear from Medicaid, we want them to respond to it. Not everybody will get renewed at the same time because we have that 12-month process that Miriam mentioned at the beginning. This is a staggered approach, and so we want to make sure that they understand you may not get it in March. It may come in September. It may come in June. Whenever it does come, we want you to be ready and to respond. What do we need? How can you support this process? Really ensure that our members have the most up-to-date contact information for all of us to pull from, right? We want to be able to contact them. It doesn't matter how many times you ask them, life circumstances changes on a dime for our members. And so we want to make sure that we're always able to get in contact with them. If they actually receive a packet, please encourage them to actually complete it. There are a myriad of different ways, and Miriam's going to kind of review all of those different components of how they can actually renew their coverage and what support mechanisms exist for that. And then for you all, we really want you to continue to provide us additional feedback and resource about how you're using our resources, how we can better support you as you're supporting our members. It's really important that you know what you're doing and you feel comfortable with what you're doing, but to the best of your ability, so that we can make sure that our members get the best possible experience and outcome from the process. So I'm going to turn this back over to Miriam, and then we'll keep going.
Thanks, Natalie. I just want to add one more thing on the previous slide. Another major thing that we need your help with, and just a reminder for all of you guys who are providers, is please check the eligibility. I know for obviously last few years, all the members were in Medicaid, nothing was being changed. But now, starting in March, that will be impacted. And so we're trying to make the renewal date visible on the provider portal so you can help and support your patients. If you see, if somebody's coming in May and the renewal date is May, it would be great messaging and support and how, if they've gotten a paper packet, please complete it. So that's something that we're working on actively right now and should have it done before the renewals begin, and we'll have lots of resources available for you all to know and and understand how you can read the provider portal information and the renewal dates. Thank you, Natalie. And just going into how do members can complete and submit their renewal packets, all the same ways that were available throughout the previous years or throughout the whole time. Calling Cover Virginia, going to Common Health Portal, and then visiting your local Department of Social Services and submitting it in person. And I believe that's kind of all. Oh, this one last session slide. Other sessions on different specialty groups. You can go to next slide, Natalie. Thank you. Here's all the information. Very similar content will be discussed as what we discussed this morning, but obviously the questions will be a little bit focused towards specific provider groups or specific populations. So I believe that's all we have, but we have gotten lots of good feedback in the chat, and I apologize for having that beeping noise. We'll make sure in the future town halls we will disable that feature to make sure that's available for that's not, you guys don't hear that. And I've received several great questions in the Q&A, but also via the RSVP process. Our hope is to address some of the questions today, and if we can't cover it all today, we're just gathering all the questions together, responding, providing the response, and then we'll post it all on the same DMAS webpage where all the town hall information is available. In addition, these slides will be publicly available soon, and the recording of the session, so you can share with your colleagues and friends and anyone you think you would be helpful for. I got one really good question, Natalie, if you don't mind. I can kind of take that one first because I think it's really important for folks to not realizing this. The question in the chat is, can the members self-start the renewal process themselves, or do they have to wait to get a letter? This one's funny because we would want people to have Medicaid coverage as long as it's possible. So if you started, if your renewal is not till December of 2023, but you started in July and you call the call center, for example, and you want to do your renewal in July, we will take that information. But obviously, if you're not eligible, you will lose those 4 or 5 months of time period of Medicaid coverage that you would have continued on if you had waited till December. So we encourage folks to stay on Medicaid as long as they have to. When you get a paper packet or when you get renewed automatically, and you'll get a notice and you're done. If you're very, very proactive, we won't discourage that either.
All right, we have a couple of other ones. Let's start with this one. And we have a couple of members from DMAS that have joined us. Tina and is it Anna? I think if they're in the background somewhere, so they'll make sure that they help us as we need to. All right, so what will be the biggest obstacle for providers during the unwinding period? That's the question we received. Whoever wants to take that one.
Good morning. This is Tia Lewis. I'm the Division Director for Program Operations. The biggest issue with providers is an ongoing issue that we currently have with providers, and it goes back to what Miriam talked about with verifying eligibility. I just want to make a quick addition to her statement. Medicaid eligibility is month to month. As a provider, you should always check the member's eligibility each and every time that you see them. It's going to be even more important with the unwinding. If you verify the member's eligibility, then it should help you be fully aware of any of the individuals that were affected by the unwinding, and maybe their coverage was reduced or interrupted for whatever reason. But it's very important that you check the member's eligibility. I don't want to put a provider in a situation where they're seeing a Medicaid member and the coverage has been changed, because obviously we know that's a hardship for you and it's a hardship for us as well. I see several questions in the chat in regards to updating your provider information. You should be able to log into the MES MES portal. If you yourself are not already enrolled, more than likely either a clerk or a biller or someone from who does your billing or works with DMAS in regards to your billing is already administrator of sorts to that portal, so they should already have access. That's the avenue that you would use if you need to update any of your provider information, emails or contact information or things like that, because we put very helpful tips into that portal for providers. So in my perspective, the main thing for providers is what Miriam said, is to please be sure that you check eligibility for your members each and every time, because that's going to determine what level of service you're able to provide to the members.
Thank you so much, Tia. All right, and I think Ann is somewhere in the ether, so she'll pop up when she needs.
I'm here.
Oh, you're here. Thanks, Ann. All right, so another question that we have is, how can patients and clients cancel their coverage?
I know Kelly Polly is on. I don't know, Kelly, if you want to answer that one, but that one's pretty easy. You can call Cover Virginia. Oh, here we go, Katie, you can do that.
If someone wants to cancel their coverage, they, as Miriam was mentioning, they can go to Cover Virginia and put that request in online. They can contact the local agency and ask to close their case, because during the past 3 years, I think it's been mentioned, we did not take any adverse action. So there are a lot of people open that maybe they've had a change and just want to close, but they have that opportunity to close it if they want to. They just need to contact the local agency via the Cover. They can contact Cover Virginia. They can go on Common Help, or actually contact the local.
Sounds good. All right, we have another one that came up. If a client is determined no longer eligible for Medicaid, how much of a notice will they receive before termination of benefits? Who wants to pop in and take that one? All right, go for it, Katie.
They receive, we're required by law to provide them with advance notice, which is at least 10 days prior to closing. For example, if we're going to close you on May 31st, we have to at least have sent you a notice of action by May 20th, I believe. However, due to system limitations, we have what's called Medicaid cutoff, which is the 16th of every month. So if someone's renewal is due in May and they haven't returned all the information, we're going to have to close that case in the system by May 16th. And so that's going to generate a letter to them advising them that their case is closed effective May 31st. And I just wanted to take a quick minute, because I saw the question pop up on the 90 days. There is that 90-day grace period. And if the verification or renewal is returned during that 90-day grace period, coverage is reinstated back to the date it closed. So if a case closed May 31st, all information comes in, renewal or verifications, it's reinstated back. So they have coverage June 1st. So they won't experience a true break in coverage. There might be some upset in their MCO getting canceled, because that happens. And then they go fee for service, or what I call straight Medicaid, but then the MCO picks right back up. So that process is in there as a safeguard, and that will assist the client. But again, that they have that 90-day period, they can get the information in and get it reinstated back to the date it closed. So I just wanted to sort of reiterate that.
Thank you so much, Katie. All right, so a couple of questions. I saw some questions in the chat alluding to this, and this one I can answer. Will DMAS send provider signage and brochures to make available in waiting rooms? And I saw one about if flyers will be available for members. So yes, we have all of those materials on our Cover Virginia website. We have sent information to our CSBs and our LDSSs. Any provider stakeholder has the ability to go onto our website under our member section, and so that you can, not member section, under Cover Virginia, in order to order materials, under the material section, in order to order a few things. Right now, the only ones that are available regarding updating contact information, I did see this in the chat, are the member flyer, the stakeholder flyer, and the member poster. And you can order those now. It's really easy to get to. I'll drop a link. I did see somebody drop a link in there about the toolkits, which is great. I'll drop a link in the chat as well for the materials page, where you can go on and directly order those items, and it will come directly to you. It takes no more than like 3 minutes to fill out the order form, and then you'll have them to place into your waiting rooms, or if you're going to community events, if you want to drop them off at a certain organization that you serve, you are more than welcome to do any and all of those things. If you find that there's something in there that you wish that you had, let us know. We also created some templates earlier in the process for phase one so that you can personalize some of this. It still has our standard messaging on it, but you can add some different things on there from a provider standpoint, just to let them know that they've received it from you. If you want to do that, you can do that as well. Just contact me directly regarding that, and I'll drop the cover. Well, it's covervirginia@dmas.virginia.gov. You can contact us there, and we'll make sure that you get that information. So the next question that came up is, you need more town halls for providers and more notice to be able to schedule people to attend. And Miriam, do you want to take this one?
Yeah, we're happy to do as many as you guys need to. If you have a specialty group, you think that would be helpful for them, or if you're a hospital association, or you have hospitals that have navigators and assisters in hospital, and it would be helpful for them. Whatever the need is, we're happy to have it. We would like to get this information out there and make it helpful. So we're happy to do that. Feel free to email us and or drop it in the chat if you're interested. We'll be happy to coordinate that. Natalie, I have one question I want to address, and I think it's really
go right ahead.
cool that we have gotten in the Q&A box. The question is, how many people are we expecting to either lose Medicaid or to temporarily lose Medicaid? So our data analytics group has been looking at national data as well as our data pre-pandemic, and in terms of what the coverage loss potentially would be. We are anticipating 14% of coverage loss during this unwinding period, and 4% of that, of additional 4% of coverage loss, but they will come back within 6 months, if that's helpful to understand. So 14% is what we're anticipating based on the national averages and some of the data we have reviewed ourselves for our Medicaid program. So there's a lot of numbers flying everywhere, but I wanted to just kind of highlight those two numbers. 14% is what we're anticipating, and 4% of the individuals who will temporarily lose, but then come back to the Medicaid program within the 6 months period.
Sounds good. And this may be connected to a question that was answered earlier, but whoever wants to grab this one. As a provider, after April 2023, we must check eligibility of all of our Medicaid patients, correct? Will Medicaid pay for claims up to April 2023?
I'm trying to find the best way, and I might need more clarification. As a provider, you should be checking eligibility today. Medicaid is month to month. Many of our members move between fee-for-service and managed care. There may be a interruption or a change in their coverage. Their resources may change and make them eligible for other groups. So you should be checking eligibility today. And the reason I'm saying that, I get to view the amount of claims that we receive for numerous reasons that I know relate back to not checking eligibility. So my suggestion would be to get in a good habit, understanding that I know with staffing issues and things of that nature, providers are taking on this task, but you really will be helping yourself by checking eligibility today. The second part of the question is in regards to claims and how you bill it.
Yes, Tia. It said,
as long as the eligibility at the time that the service was received. I'm sorry, go ahead.
Oh, no, I was clarifying. You had gone ahead and started to answer that question.
Okay,
So go
thank
right
you,
ahead.
Natalie.
Mhm.
As long as the patient had was in a fully Medicaid group at the time that the service was received, providers are able to bill us 12 months from the date of service that those services were received. So I think what you're alluding to is, if I, Tia Lewis, have full coverage Medicaid today, and I receive benefit or receive some type of service, and then I lose my coverage in April after the unwinding, you still would be allowed to bill for the services that were received, as long as there was a fully covered group available for that Medicaid member at the time the service was rendered. I hope that answers the question.
I believe
This
it
is
does, but
Ann.
you have a bit of a follow-up one. Oh, I'm sorry. Ann,
Yeah,
did you want to
I
add
want
to
to
that?
piggyback on that because just for those providers that are providing services to special populations that need service authorizations, if they're in our DD waivers or CCC plus or whatever, if that Medicaid stops, those authorizations stop, which it should, right? But if that's even more of a reason for the provider to check that eligibility, because Medicaid ends, the authorization ends, particularly in the DD waivers. If you don't know it's ended, you can't request. And as you know, you have to have an advance request on your authorizations. It's not retro. So you really need to stay on top of that and check the eligibility.
All right, so this may be a Tia and Dua question. So it's asking, should they check eligibility on partner sites like Health Keepers Plus, or should they be checking eligibility on another site altogether?
I think that's really, we have numerous ways you can check eligibility. So if Anthem, United, and our partners at the plans allow the option for you to check, we don't have a way, we're all receiving the same information. Our partners such as Anthem receive a file feed from our main system to allow you to view members' eligibility. So it's perfectly okay to use that system. If you primarily bill Medicaid fee-for-service patients, then you probably have someone in your office is registered on our MES system, and you can check member eligibility on that system.
Our eligibility partner, Kelly Pauley, also responded in the chat or reminding folks that individuals receive 10 days notice prior to closure. It's not necessarily the provider, correct? It goes to the individual. So the individual has to communicate with the provider to let them know if the provider doesn't check that eligibility. So again, just checking that eligibility.
Thank you, Anne. As well as we have very good resources with our provider helpline in regards to eligibility. There's a wonderful 800 number, and you don't have to speak to a person, which is a 800-884-9730. If you have a national provider identifier, you can enter it, and it will allow you to check member eligibility and provide you with the results for that member, down to even if the member is enrolled in one of our partners with the managed care plans. It will give you that information.
Tia, someone asked you to repeat that number or tell them where that number can be found. Or
absolutely, it's 1-800-884-9730. It's called Medical.
Did you say 9330? Because I'll type it in the chat.
I did. It's 9730.
All right. And this may circle back to what Miriam was explaining before, but they were asking about reporting and if providers will be able to access reports regarding end dates or when the redetermination dates will happen. I know our MCOs get some reporting, but will the providers be provided reports as well for their groups?
Yeah, no. So the providers will be. What we're doing is working on the provider portal that Medicaid DMS has to make when you check when the member's eligibility, they'll have a renewal date field as well there. So they can see the renewal date. So for example, Miriam Siddiqui, eligibility, active, and then her renewal is not till July. We are in, as we talked about, this is a batch process. Every month, a certain group, certain members who have eligibility coming, the renewals coming up, they will go through that. We will make that calendar public very soon. We're just working on final data to make that make sure we're set for the unwinding. Once we make that public, we will, as providers, as members, as advocates, you can see, okay, Miriam's eligibility is coming in July. The automated process will run in May, and she may get a packet in month of May to complete. That's how the system works. So if when Miriam sees you in your PCP office, and remind her, hey, you'll get you should have gotten a paper packet, or you'll get a paper packet potentially, whatever notice you may get. This, keep everybody informed and make sure you kind of flag that for the members, for the patients. We'll make that, it's a complicated process. We'll make all that public information, all the information public to make sure that you have plenty of resources available to support your patients.
It sounds like you already answered the next question that I was going to ask you about the members' renewal dates, how they being determined. And you definitely said the one word is a complicated process, but it is a process. Um,
Yeah.
yeah.
Another one I want to mention, sorry, Natalie, one more question that I think is a really good one. It says, how will DMS and DSS help individuals no longer eligible for Medicaid or CHIP find other sources of health insurance, such as Marketplace, employer coverage, and Medicare? Great question. That is exactly what we've been thinking through. We obviously want to make sure that we go through all the eligibility process and maintain our members who are eligible. Individuals who are no longer eligible for Medicaid, we transition them to Marketplace. So our automatically, if they're considered ineligible for Medicaid, we send a file to Marketplace. And so FFM or ACA Marketplace gets that information for those folks who are ineligible. In addition, our MCO partners have been supporting that as well. So if the individuals are no longer eligible for Medicaid, they'll be helping us with the transition into Marketplace plans. So we're thinking through that transition. We have support from our additional stakeholders and navigators, application assisters and navigators to support members who are transitioning off of Medicaid.
A really quick one, will the renewal application change or has it changed?
It has not. We actually made some additional, there's a front page of it to make it easier for members to understand like how different ways they can complete it and submit it. So I think we have made our renewal packet simpler in terms of just, understanding how to submit it. That packet itself hasn't been changed, but I did note, and somebody suggested that in the Q&A, I believe, to make some of these documentations available as a sample documentations on our website. I think that's a great suggestion. We'll make that happen, just so people can see, okay, this is the form I'm looking for, or this is the document I will receive, and just having that visual sample would be helpful, I think. So thank you for that suggestion.
As a follow-up, and I think I can start the answer to this question, and one of the team members may be able to follow up. They said, "What will the unwinding process look like?" And funny enough, we were able to create a resource that kind of demonstrates what that looks like. And actually, I think I have a copy of it here today. Here. And so we tried to make sure that we were able to visualize what that process will look like somewhat. There's always nuances to things, but it definitely delineates what's our responsibility, what's the member's responsibility. These will be available. These are actually currently available on our website, so you can download, print them out for your members and stuff like that. We'll have some available for ordering as well once we get that into our warehouse. And so that's what we're a visual representation, something that you can hand out. But if Tia, Ann, or Katie want to respond to what the process in of itself may look like in a little bit more detail, you are welcome to do so here.
I guess I will take that. This is a really handy flow chart. It just kind of gives you an idea of what the process is. I saw in the chat that Kelly had answered the question about when the redetermination packets would be mailed. And those are mailed out the month before they're due, or I'm sorry, 60 days prior to the month they're due. So in March, they're going to mail out renewals that are due for May. And in that process, we talked about the automatic renewal process, and I saw a lot of questions about how do people qualify for an ex parte or automatic renewal. Those are cases that do not have a resource test. So cases that have a resource test are individuals that enroll in age, blind, disabled coverage, and also your LTSS recipients. I'm losing my voice. And so because there's a resource test, we can't ex parte their redetermination. And so they will get sent a packet. So to qualify for an ex parte, you can't have a resource test. So that's going to be primarily your families and children, individuals, famous individuals that are SSI recipients for the most part. If you're an SSI recipient, but you have real property, you can't be ex parte because we have to evaluate the resource. But that's kind of how the automatic renewal gets generated. If there's a resource test, it's going to drop out. And so the system's programmed to recognize coverage codes that would fall out of that process. And so if they get mailed a paper renewal, they are sent out, they have a renewal date on there that the information is due back to the local agency to complete the redetermination. And if that redetermination is not received, then they will be closed by the end of their renewal month. Example 531. I saw another question. Their, applications are 45 days, but renewals are to be processed by the month they are due. If they return their information late, they have 30 days from the date the information is received to process that. And again, to reiterate, that will be no break in coverage if information is received within the 90-day time frame. If the renewal is returned and information is required, such for the aged individuals, we may need verification of some of their resources. We do have an electronic system that can help verify liquid resources such as bank accounts, money markets, etc. At times it is very responsive, sometimes it's not. So the customers would be sent a checklist with a due date telling them what they need to return. Other times, if there are discrepancies in what electronic sourced income comes back is, someone might be sent a checklist if they fell out of the ex parte process and had to complete a paper renewal.
Good morning, Kim.
All right. And
Natalie, I believe, we have about 3 minutes left. I
Mhm.
might be a time for us to maybe do a closeout.
Absolutely, I was thinking that. The one thing I will say is we thoroughly appreciate your engagement. I think for all the different work and the components of this work, it is always one of those things where you can get into a setting with like-minded people to answer and to ask questions that can be answered because you may be thinking of those things. So it does not go unnoticed that you took the time early this morning to hop on here. We have over 360 people join us today, which is absolutely phenomenal. As a team, we're very encouraged and we're excited about the opportunity to work with you and make sure that you stay engaged. We also want to make sure that you have what you need. And I want to shout out the team that has been working in the background, Casey and Rebecca and Anita, everybody here at DMAS, as well as others that have been trying to answer questions. Kelly, who's been trying to do them as well, in order to make sure all of these questions that you have get answered. We will have this presentation posted on the website at a later date. We're also going to follow up and try to make sure that we have an FAQ document generated so that some of the tried and true questions are available there. We also want to remind you that we have other sessions coming up. So if you find yourself in the opportunity to join us again, please do so. You can scan this QR code. It takes you right to the website. We also want to remind you that this work is thankful work, right? It's good work. Our agency director also often reminds us that our members are number one. They are the things that we think of first and last, and we want to make sure that in that process that you are taken care of as a stakeholder while we're trying to get that done. If you have any questions for us, don't hesitate to reach out. If you want to join us again, we welcome you to do so. And we hope that you have a wonderful, wonderful Tuesday. I hope that we added some joy to your day, if not anxiety, and that you join us again at a later date. If you have any questions for us, you can continue to drop them in the chat. I'll stay on for another 5 minutes, but you are free to go. We thank you for your time. We thank you for all of the work that you do, and we hope that you have a wonderful day.
Thanks, everybody.
Hey, Natalie.
Hey,
Hey, it's Rob. How are you?
I'm good. Who is this again?
I'm talking about Central Virginia Health Services.
Oh, how are you? Great. I'm gonna stop sharing.
Natalie, you don't remember me.
Is this Robin? I forget. I'm sorry. I can't see whose name it is. It's so many people.
Yeah, it's Robin Tyler, Natalie.
Yeah, I definitely remember you. How's everything
Okay,
going?
I'm doing well, but can you reach out to me? Our outreach team. I left my email in there. We're doing our first in-person meeting on next week, and want to know if we can Zoom in or set up something. Can you just give me a call?
Sure. So let me drop the Cover Virginia information in there. Make sure you drop it there too, and just place my name in there, and I'll reach back out to you. Okay.
Okay, I appreciate it. Let me go back to the chat.
All
Okay.
right. I'm putting it in there now.
All right, thank you.
No worry. Oh, did I send it to myself? I sent it to myself. I didn't even know you could do that. All right. Have an awesome one.
You do the same. I'm just waiting for it to pop up.
Is it not popping up?
Uh-uh. The last one came from Latanya at 8:31.
Okay, I'm gonna try it one more time.
There we go.
There we
Thank
go.
you.
Okay. You're welcome. Everybody's going.
Natalie, I just want to make sure that we download the chat and the Q&A.
I did. I
Okay,
put that in the
perfect.
chat for Casey, and I just want to. I said I don't want to stop it until we
Yeah.
have done.
Yeah,
Until we
yeah,
get that
I
part.
agree. Okay, great. Thank you.
You're welcome. Thanks so much, Katie. We will see you on Thursday, right?
Soon.
I will see you soon.
All righty. You let us know if you need anything.
Thank you.
You're welcome.
Thanks so much,
Irma?
everyone. It was great.
Thanks, Irma.
Katie, you did great.
She did great. Yeah.
All right. See you guys next time.
See you later, Irma. Thank you.
And Natalie, there's a question from Cheryl. That's
Oh.
Cheryl Gallen, and she says they have different types of providers for the additional question. Cheryl, if you're still on, I would suggest, yeah, reach out to us and see if we could do another session. If you have, like if you have a big team or if you have an upcoming meeting coming up, we'll be happy to jump on and do similar type of, maybe even, depending on what your need, do a shorter presentation and just sort of focus on the Q&A. So.
Yes, I'm still on, and that would be awesome. We are a different type of a provider, and we do
Don't
provide.
mind, if you don't mind telling us what kind of provider you are, so we can make a note as well.
We are a senior medical center. It's through GenCare.
Oh, we have Medicaid programs for older adult session coming up as well.
Yeah.
Yes, and because of that, we partner with our health plan partners, and so we're seeing duals as well, and trying to figure out how we can really help our patients going through this process. What are the resources? I've seen the different toolkits, which are awesome. Thank you guys for that. I will be downloading them to use those, but just as we communicate with our patients, what are some of the key things we need to tell them? Of course, we know, make sure your information is updated, pay attention to dates. Because we're not a Medicaid provider, we don't have access to the Medicaid provider portal to even be able to look at their dates. So just kind of trying to figure out how we can get more information that we can support. Because to your point, our goal is to make sure that everyone retains their benefits as much as possible. But just be a resource to help as well, whether that's our team helping to facilitate something or what. We're ready to make our teams available.
That's great. Thank you, Cheryl. I appreciate the proactiveness here, and we'll be happy to jump on. Just feel free to email in that email box, and we'll find time and make it happen.
Okay. Can you send me the email box address, or is it just?
Oh, it's in the chat. It's Cover Virginia at
just that one.
dmass.virginia.gov.
Thank you.
You're welcome.
All right, I'm going to jump off at this point. Natalie,
All
thank
right.
you so much.
Have a good one. I'll work with Casey to get the other thing done.
Thank you. Bye.
Bye.